Hello, Namaskar. I am Dr. Murali Manohar. Welcome to my lecture, Ayurveda Samhita. In this program, we will be learning and knowing about an important topic and some powerful ancient Indian Ayurvedic secrets. These can change and improve your entire life. In this program, I am going to talk about lipoma. How can we define this condition? A lipoma is a slow-growing fatty lump that is most often situated between your skin and the underlying muscle layer. A lipoma feels duffy and usually not tender, moves readily with slight finger pressure. Lipomas are usually detected in middle age. Some people have more than one lipoma. A lipoma is not cancer and usually is harmless. Treatment generally is not necessary, but if the lipoma bothers you, is painful or is growing, you may want to have it treated. Ayurvedic treatment is effective for this condition. We are going to know about the details. But before going to this, let us know some symptoms of this lipoma. In fact, how to identify these lipomas? Let me explain these symptoms. Lipomas can occur anywhere in the body, but usually uncommon on face. Lipomas are situated just under your skin. They commonly occur in the neck, shoulders, back, abdomen, arms and thighs. Lipomas are soft and duffy to the touch, to the feel. They also move easily with slight finger pressure. Lipomas are generally small. They're typically less than 2 inches, that is 5 centimeters in diameter, but they can grow. Lipomas are sometimes painful. They can be painful if they grow and press on nearby nerves or if they contain many blood vessels. Lipomas can also manifest unusually, less frequently. Some lipomas can be deeper and larger than typical lipomas. Now you should know about the warning signals. A lipoma is rarely a serious medical condition, to put it in a simple sense. But if you notice a lump or swelling anywhere on your body, have it checked. In fact, you should know the causes for this condition. The cause of lipoma is unknown, but lipomas tend to run in families, so genetic factors likely play a role in their development. Also, you should know the risk factors. Several risk factors may increase your risk of developing a lipoma. Let me throw some light on these risks. Being between 40 and 60 years old is a risk. Although lipomas can occur at any age, they are most common in this age group. Lipomas are rare in children. And having certain other disorders is a risk. People with other disorders including adiposis dolorosa, Cowden syndrome and Gardner's syndrome have an increased risk of multiple lipomas. And genetics is another risk. Lipomas tend to run in families. Now let us know something about Ayurvedic consultation. It's important to furnish some information during the consultation. Some basic questions include: When did you notice the lump? Has it grown? Have you had similar growths in the past? Is the lipoma painful? Have others in your family had similar lumps? These are the general questions that you can expect during the consultation. As far as the diagnosis is concerned, to diagnose a lipoma, some tests are performed. These tests include Nadi Pariksha or pulse examination to assess your body type and this lipoma disease. A physical exam is also performed. A tissue sample removal, that is biopsy for lab examination, may be advised. An ultrasound or other imaging tests such as an MRI or CT scan, if the lipoma is large, has unusual features or appears to be deeper than the fatty tissue, may be necessary. And let us know the differential diagnosis. There is a very small chance that a lipoma resembling a lipoma may actually be a form of cancer called liposarcoma. Liposarcomas, in other words cancerous tumors in fatty tissues, grow rapidly, don't move under the skin and are usually painful. A biopsy, MRI or CT scan is typically done to confirm the diagnosis. Now, the most important thing, the treatment. In fact, no treatment is usually necessary for a lipoma. However, if the lipoma bothers you, is painful or is growing, you can opt for the appropriate Ayurvedic treatment. According to Ayurveda, this condition results due to the derangement of Dhattvagni, that is tissue level metabolism in the Medo Dhatu, that is fat tissue. You may not prevent them from developing, but certain lipolytic herbs like gugulu, musta, garlic, Garcinia species, turmeric, etc. can be used to control them. Treatment should be continued for prolonged period. The plan of action or lipoma treatment includes apatarpana, emaciating your body with lekana, that is scraping drugs, and medohara therapy. This medical treatment shrinks the lipoma but it does not eliminate it. And Raksha Ayurvedalaya. This treatment uses heat to generate sweat without the use of steam. In this way, we can address this lipoma effectively and efficiently. So, hope you have enjoyed this topic and enlightened. In the next program, we will be meeting with another interesting and important topic. Shatam Jiva Sarado Vardhamanaha. Shatam Hemantan, Shatam Vasantan. Live your entire life with excellent health and total happiness. Take care of yourself. Subham.
Dr. Chirumamilla Murali Manohar, MD, Ayurvedam, Raksha Ayurvedic Center, Sardi Studios Road, opposite State Home, Amirpet, Hyderabad 73. Phone 9177445454.